and yield next for an opening statement to the gentleman from New York, Mr. Engel. I have not thanked, unfortunately, I haven't thanked the members of the New York delegation from our own committee. Both Mr. Engel and Mr. Wiener have played a major role in putting this legislation together and pushing for it, so I want to thank both of you. Mr. Engel?
Well, thank you very much, Mr. Chairman. First of all, let me thank you for your long-standing support for providing a permanent health care program for the first responders and survivors of the 9/11 terrorist attacks on our nation. This is very, very, very personal to me and to my colleagues. We have so many of them here in the front row, Mr. McMahon, Mr. Towns, Mr. Nadler, Ms. Maloney, Mr. Tonko. They're all here because we're really all in this together. I have and they have friends who died at 9/11, constituents who died at 9/11. I represent Rockland County. We have more policemen and firemen living in that county who perished on 9/11. Dennis Hughes, the head of the AFL-CIO, my constituent from Rockland, is here. We have a whole array of New Yorkers here. This is very, very personal to us. I want to single out Ms. Maloney and Mr. Nadler. This is in Mr. Nadler's district, the World Trade Center. Ms. Maloney has been spearheading this. And this is so important that we not only help the people who selflessly came in and rolled up their sleeves and did what they were supposed to do, but also the people who live in the immediate area through no fault of their own, who were told that everything was safe and everything was fine. The terrorist attacks were an attack on our nation. And New York City and the surrounding area should not be left alone to bear this burden. We've talked so many times about this bill, Mr. Chairman, and I appreciate all the time that you and your staff has done leading to this day. We're really lucky. New York is lucky to have you as chairman because you always recognize that what happened to the Americans living in New York on 9/11 could have happened to any area of the country, but it happened in New York because New York is the symbol of our country. So let me say, as devastating as that day was, there were few days that I've been more proud to be an American than on 9/11. Within minutes of the crashes into the Twin Towers, New York's first responders mobilized to save those trapped within the World Trade Center, putting themselves in unspeakable danger, and too many lost their lives that day. Within over 40,000 responders from across the nation descended upon Ground Zero to do anything possible to help with the rescue, recovery, and cleanup. We all remember seeing Americans lined up around blocks to donate blood. I remember the chaos as no one quite knew what to do, only that they wanted to do something to help our nation rise up from the assaults by the terrorists. And it's to help our nation. Let me remind my colleagues, not to help New York, to help our nation. These people who went in were helping our nation, and they should be taken care of now, years later. They thought they were safe. And I wonder if we can hold that up, because the federal government told them they were safe. Come into New York and you'll be safe. On September 18th, 1 week after the World Trade Center attacks, September 18th, 2001, the EPA chief, Christy Todd Whitman, said, and I quote her, "Given the scope of the tragedy from last week, I am glad to reassure the people of New York and Washington that their air is safe to breathe and their water is safe to drink." Unquote. What a disgrace for her to make a statement like that. How shameful it is that she made a statement like that. And just 2 days before that, the OSHA Assistant Secretary of Labor, John Henshaw, said, quote, "Our tests show that it is safe for New Yorkers to go back to work in New York's financial district." Unquote. The nerve of them, the gall of them, how shameful of them. And you know what? It wasn't safe at all. And that's why we're here today, to make sure that, God forbid, if we ever have another terrorist attack, that our citizens don't stay home out of fear, and the federal government won't be here for them, as it hasn't been consistently for our 9/11 heroes. The past 8 years, Mr. Chairman, has not been kind to so many of the first responders who put themselves in harm's way. It's estimated that up to 400,000 people in the World Trade Center area on 9/11 were exposed to extremely toxic environmental hazards, including asbestos, particulate matter, and smoke. The illnesses that those exposed to the toxins develop are severe, debilitating, and for many families, simply devastating. The attacks came on Tuesday. Friday, the entire New York delegation was there with President Bush. I'm sure we were all exposed to it as well. But the difference is we didn't go there day after day, week after week, to try to help others. The comprehensive bill before us ensures that everyone exposed to the ground zero toxins has a right to be medically monitored, and all that are sick have a right to treatment. It would also rightfully provide compensation for loss by reopening the 9/11 Compensation Fund. Before I close, I just want to comment on the gentleman from Illinois, my good friend, who is my good friend and who is a very, very thoughtful member of Congress. But let me say, please spare us the lectures about deficits. Please spare us the lectures about deficits. Because for 6 years, when the other party was in control of this Congress, with the presidency in both houses of Congress, deficits went higher and higher and higher with red ink as far as the eye can see. So please, let's not balance the budget on the backs of the 9/11 responders. Let's not talk about deficits when we're talking about 9/11 responders. It seems like the federal government always has the money when it needs it. Well, we need it now, and we demand it now. Thank you, Mr. Chairman.
Thank you, Mr. Engel.